Are you a cash-based physical therapist and you find yourself stuck at the initial evaluation, or you want to find out there's got to be an easier way to do my initial evaluations? You feel like you're tailoring every single thing to every single patient, and I'm here to explain why this is not right in a cash-based setting. My name is Dr. Garcia. I'm a specialist in helping cash-based PTs like yourself really improve outcomes and enjoy the career that they've always wanted to. So when you look at initial evaluations, we think that from an insurance-based setting or a PT school setting, you think that every eval, every person has to be different, and you have to do these 27 special tests and these 5 different outcome measures on this individual. Now that might be right for an insurance-based setting because you're ultimately trying to prove your value to a company that has nothing to do with you or the patient. Now when you get into a cash-based setting, that patient ultimately wants the outcome, and when you find yourself trying to individualize every single treatment, and that's probably the reason why you got into cash-based PT in the start, is that you wanted to have a more customized, personalized experience, not just 15 minutes of the same routine over and over again. But here's why personalizing actually does you harm. Most of the time when you get in your first 2 years, 3 years of cash-based setting, you find yourself stuck with, you've done all these different evaluations and you really don't have a system, you don't have a flow. And when you try and customize everything, you find yourself even more lost. So one of the biggest things that you can do for yourself is find structure. Take your time, spend about an hour or two on a piece of paper or a whiteboard and design what a traditional good initial evaluation would be for your style. Now create that framework, and what's ideal look like? What do the first 5 minutes look like? What do the first 10 minutes look like? What is it in the middle of that session, and what happens afterwards? Now you get to the plan of care creation. How do you design that? Well, for an insurance-based care, you knew it was 2 times 6 or 3 times 18 or whatever the number was. And when you get too customized, you actually confuse the consumer. So when you look at customizing and personalizing, that might be great for a few people, but ultimately it comes down to it. When you start treating at a higher volume and you have a consistent, steady flow of patients, you want to make it simple for the consumer. That's ultimately who you're thinking of, not for yourself. The consumer doesn't want individualized, personalized, one-on-one care. They just want a solution, and they want it in a simple form. So every time that you create a plan of care that's so customized, it becomes very difficult for them to follow along. And when you start working with other people, you grow a staff, you have people on your team, administrative or other PTs, everyone's trying to treat like themselves and they want to make it more customized. The problem is that you no longer have an actual standard outline of how you do things inside your business. And that leaves a lot of chaos inside. Now, when you're starting, this seems like, oh, it's normal. That's why I got into the business. Now, if you're looking at how to improve this long term, you have to create structure. Create an outline of what does the first 6 weeks look like inside your practice, what does the next 12 weeks look like, and standardize that process. You might say, well, not every back patient is the same. Yeah, but healing is the same. It's going to take you 4 to 6 weeks to build neuromuscular control, 4 to 6 weeks to get strong, and 4 to 6 weeks to build endurance on that. And then from there, you can decide if you want to go into hypertrophy or if you want to go into strength and conditioning or into plyometrics, whatever it is based on the athlete. But there's an outline to follow. And when you get in cash-based care, you want it to become so customized that you have chaos inside your business. So to simplify the process from the initial evaluation, create an outline of what a 4 to 6 weeks look like inside your business. What does a normal initial evaluation look like? What's an hour look like? And what's that framework? Instead of trying to customize it for 27 different patients, why don't you create one framework and figure out how everyone fits into that, but still don't lose your identity or the identity of your staff, because you guys are artists and you really appreciate creating everything inside your plan of care. But when you have a framework, it helps not only the patient, it helps your staff and it helps you think better, so that way during that session you're not stressing, you're actually just enjoying the time with them. So when you have an outline, it makes it simple on the patient, your staff, and yourself. So instead of trying to customize everything, every single session for every single patient, why don't you create structure and outlines that make it templated? It's a program and it's a script and it's easy for everyone to follow. That's the irony. You came from an insurance-based world where that was a standard. You went to total freedom and created chaos for yourself. Now you're back into creating structure. So there you have it. That'll help you create success for the patients inside your practice and beyond. Enjoy.